Hello, my name is Jeong Park, and I'm currently in the Department of Korean Pharmacy at Usok University. Today, I would like to present a review on the role of MMP9 in acute liver failure called ALF and its complications, and how these mechanisms can be interpreted in the context of traditional Korean medical pathogenesis. First, the liver is a key organ responsible for carbohydrate, protein, and lipid metabolism, as well as detoxification. Because it receives a large volume of blood flow, it is particularly vulnerable to external toxic agents. For example, overdose of acetaminophen or viral hepatitis infection can lead to acute liver failure. This, in turn, may cause complications such as hepatic encephalopathy called HE, multiple organ failure called MOF, and liver fibrosis. Across these complications, MMP9 has been identified as a critical pathogenic molecule. Under normal conditions, MMP9 supports liver regeneration and maintains ECM homeostasis. However, during ALF, increased ROS and inflammatory cytokines stimulate Kupffer cells and neutrophils to overproduce MMP9, triggering a cascade of reactions. First, in HE, circulating MMP9 reaches BBB and degrades tight junction proteins such as octolidin and claudin 5. As a result, BBB permeability increases, allowing toxins like ammonia to enter the brain, which can cause cerebral edema and altered consciousness. Traditionally, this resembles 간화상염. When dampness in the liver transforms into stagnation, it generates fire that rises upward, disturbing the head and mind. Second, in MOF, MMP9 released from leukocytes degrades the ECM not only in the liver, but also in other organs such as the lungs, inducing systemic inflammation and tissue injury. This parallels 간경습열 spreading to other organs such as the spleen and lungs. If not controlled, this kind of heat poisoning consumes vital qi and spreads systemically. Third, in liver fibrosis, MMP9 has a dual role. On one hand, it activates TGF-beta, promoting hepatic stellate cell called HSC activation and ECM accumulation. On the other, MMP9 derived from Kupffer cells or restorative macrophages can degrade ECM and facilitate fibrosis resolution. This aligns with 간음허 in Korean medicine, where prolonged heat and toxin deplete the yin and blood, weakening regenerative capacity. Therefore, by examining abnormal MMP9 activity together with traditional pathogenesis, we can see that the disease course and its pathophysiology are closely related. Currently, standard ALF treatments focus on liver transplantation or management of cerebral edema. Recently, however, two main strategies have emerged to modulate MMP9. First, direct inhibiting agents such as GM6001, MMP9 antisense oligonucleotides, or minocycline have reduced MMP9 activity and improved liver injury, BBB permeability, and cerebral edema in animal models. Second, indirect regulation and balance. For example, TGF-beta1 antibodies, doxycycline, or diasterin can block the MMP pathway. In fibrosis, approaches aim to enhance MMP9 activity from Kupffer restorative macrophages and restore the TIMP1 and MMP9 balance. These findings suggest that beyond simply blocking MMP9, context-dependent, flexible modulation tailored to disease stage and cellular environment is needed. In sum, developing personalized therapies based on MMP9 modulation may open new avenues for treating ALF and its complications. Thank you for listening.